We believe that you are the divine physician, the healer of all. And so we ask that you bring your loving and healing presence to comfort those who are sick and suffering. Have mercy on those who have died. We ask you to stand at the side of all medical professionals and frontline workers who are putting themselves at risk while they work to bring healing to others. Lord, we are scared. Send us your peace and your overwhelming presence. We praise and thank you, your Father and your Holy Spirit, now and forever. Amen.
Good evening, everybody. Thank you, Vivienne, and to all our distinguished guests and speakers. The Preston Mosque has taken lead with other organisations and organising such events to bring factual information from experts in their fields to our community. And I remind all tonight of the Holy Quran, which repeatedly says to seek advice from people of knowledge. And this is what we are doing here tonight, hearing from community doctors firsthand. Ya Allah, you're the all-seer, all-knower. Ya Allah, I ask you to make this discussion today of benefit and use, to open everyone's hearts and minds. Oh Allah, please heal all those impacted by this disease and others, and keep us and our loved ones safe. Amen.
Thank you, Monsignor Joseph Taki OAM and Mr. Tarek Cord. I hope I pronounced your names correctly. Now, before we hear from our panel speakers, we'll first hear from Hugh Valley, manager from the Rapid Response Engagement and Testing team from the Department of Health, to give us an update on the current outbreak testing and clarification of any isolation information. Thank you very much, Hugh.
Thanks, Viv. Good evening, everyone. Salam alaikum. Thank you for the invitation to join you all tonight in what is a very busy period. I've got a couple of slides that I might share, Viv, if that's okay.
Please go ahead. Thank you, Hugh.
Now, I think you're going to have to allow me to share as a participant.
Just have made you co-host.
Thank you. Okay, lovely. Please let me know if you can see the slides okay?
Yes, we can.
Terrific. So before I begin, I was kind of touched and struck by a couple of comments earlier just before we officially started, and even in the introductions, you know, Faddy saying about a loud and clear message. I think that's really important for our community at the moment throughout Melbourne, and especially the Lebanese community, who, as you know, Moustafa has said, you've been really impacted by this virus. And I want to acknowledge the impact that COVID-19 has had on the friends and family in this community. I'd like to acknowledge country tonight. So where I am in St. Kilda, the Wurundjeri people of the Kulin Nation, and pay my respects to their elders past, present and emerging, and also any First Nations people who might be in the room tonight. COVID-19 has been a major challenge for us all. And also any First Nations people who might be in the room tonight. COVID-19 has been a major challenge for us. Update, which is an update on some of the numbers relating to COVID-19 at the moment. Today, there were 445 cases, which were acquired locally, and we are seeing a gradual upward trend in local acquired cases. At the moment, we've got over 3,700 active cases. And the testing numbers have been really good recently. As Fazzy said, people have come out in numbers to get tested, and that's really encouraging, and we really want to keep that continue. So we had over 42,000 tests yesterday. And in fact, with the vaccines, we had over 36,000 vaccines administered yesterday. So in total, since the 22nd of February, there's been over 2,864,000 vaccines delivered by the state. You can see from this diagram, it shows the current active cases by LGA, our local government area. And the darker the shading indicates the higher number of cases. So we can see the LGA of Hume, which we would have heard in the news, has been impacted quite a bit and most seriously. You've also got some neighboring LGAs like Moreland, Whittlesea. We're going to be sending some engagement teams to Melton tomorrow as well as part of proactive work to try and increase awareness about testing and vaccination. And also everyone that whereas previous strains seem to impact people who are older, especially over the age of 60, this strain of coronavirus, the Delta strain, is affecting young Victorians. It's making people very, very sick. It's putting them in hospital, putting them on breathing machines, as Dr. Ashraf was mentioning earlier. So the key age groups that are affected when it comes to cases at the moment are those aged between 20 and 30, followed by those aged 30 to 39. And then we're seeing quite a few cases in much younger people, so age 10 to 19, and also those between 40 and 49. So if there's anything that we can take from this slide here, it's a reminder that this is a virus that's really impacting on young people in the community very seriously, and that all age groups from 10 upwards all the way to kind of 60 are heavily representative in the overall numbers. My team, along with Mia Bromley and Roberto and a few others, we work really closely in testing and engagement, and we do try and deliver key messages as we do our work. One of the big messages at the moment is if you're feeling unwell, please do not go to work. If you're on a construction site as a builder, or whether you work in an office and you're permitted to go in, if you don't feel well, please don't leave your house unless that's to get a test. We know about the symptoms at this stage, so fever, chills, sweats, cough, sore throat. We don't need to be reminded of those, but it is important that if people have any symptoms at all, go and get a test. There are nearby testing locations in the north and the west and all across Melbourne. And once you get your test, return home immediately and wait for your test result before returning into the community. Don't go out shopping, stay at home, call a friend if you need anything. The only reasons to leave the house would be for an emergency or to seek some medical care. There are also payments available. If you do need to get a test and isolate and you can't work, or you need some support for your family, there is emergency relief funding as well that's available. Now, we've chosen to include this slide here. The data is from last week, so it's from last Thursday, which is the 9th of September, but it's a powerful reminder of the power of vaccination. So last Thursday, of all the people who ended up in Victorian hospitals, 99 of those were unvaccinated, not having any vaccine, and 12 had their first dose of the vaccine, whereas of the total people hospitalized, none of them had 2 doses of their vaccine. And I think this is an important reminder of the importance of vaccination, which I'm sure we'll talk about a little bit later. Finally, this diagram here is a healthy kind of reminder about some of the key messages that we're trying to do about getting vaccinated to reduce the chance of serious illness, wearing a mask, washing your hands, scanning QR codes, really, really important to allow the public health and contact tracing teams who are working so hard around the clock to be able to contact people and let them know if they've attended a site that turns out to be an exposure site. And as we said before, get tested if you have any symptoms or if you're feeling unwell at the moment in terms of any sort of respiratory symptoms. There are the slides for this evening, Viv. I'm happy to take any questions at the end.
Thank you very much, Hugh, for that. So we'll now go to our panelists, and if I could invite Professor Dr. Afif Hadj to say a few words, followed by Dr. Ashraf, followed by Dr. Amba, and then we'll open them up for questions. So with that, I'll please go ahead, Professor Dr. Afif.
I love that. Not only a professor, but a doctor. It reminds me, the Germans normally say professor, doctor, or her doctor, or whatever. Thank you very much, Viv. And the thing that I want to talk about is the getting out of the message to the community. When we had our meeting a week ago, I did say that the Lebanese are very intelligent people, and they respond extremely well. And I think what's happened here, sadly, is that a lot of misinformation has been given out to our community. As a surgeon, when I saw a patient that needed an operation, I explained to them the reason why they should have the operation. And then importantly, I discussed with them the possible complications of this procedure. That's what's called informed consent. Once you explain to people why you are doing things, they will come on board. Some of the misinformation which is out there is so dreadful, so awful, that people are easily frightened. And I did say last week that sadly, some of that misinformation has been coming from people in authority who should know better. For instance, I was asked that the Pfizer and the Mrna vaccines are an mRNA vaccine. Now, I guarantee you, the vast, vast majority of people wouldn't have a clue what the mRNA stands for. And the misinformation there is that we are injecting this mRNA into you to change your DNA structure. Now, our DNA is what makes each one of us an individual. So the people who are peddling this garbage either understand the relationship between the DNA and the RNA, they understand it, and they're being mischievous, or they do not understand it at all. And the reality of life is that the RNA has absolutely no effect on the DNA. Then we get other misinformation, and I mentioned it last week about some doctor supposedly in Lebanon who put a magnet over the injected site and they saw the skin elevate. And these are, and as I mentioned it was a very intelligent person who rang me up to ask me about this. Because on the internet, any Tom, Dick or Harry can say, I am a professor of such and such. And you called me Professor Doctor. Well, I have my basic medical degree from the University of Melbourne. I'm a fellow of the Royal Australasian College of Surgeons. I'm a fellow of the Royal College of Surgeons of England. I'm a fellow of the Royal Society of Medicine. So you can look that up on the internet, but someone can come up and say, I'm Professor so-and-so, and that can say, I have got my basic medical degree from such and such, and who is to verify that sort of thing. So hopefully tonight, we are able to pass on the proper medical, scientific information that people can hang their hats on. And so and I did say that the Lebanese are a people of faith. So they do listen to Monsignor Joe, they do listen to the Sheikh, they do listen to our priests. In fact, one of our priests are having an information session tonight, so that our religious leaders can go to the community and speak with confidence about true information, not the misinformation which is out there on the internet. I hope some of you saw the Australian story last night on the ABC. It had Dr. Jamal Rafi, who's a GP in Western Sydney. It was one of the best programs that I have seen. Thank you.
Should I address you as Dr. Professor, or should I just say thank you, Afif?
Your lordship is fine.
Your lordship, right? Okay. Well, thank you, Professor Dr. Afif. I will go to Dr. Ashraf, please. Thank you.
Thank you very much. Would I mind listening to Monsignor, I just wanted to explain perhaps with one slide the coronavirus from a medical perspective. Could I share my screen? It won't take 5 minutes. Is that possible? Yep. Okay. So I'll just hopefully you can see this. So I just I'm one of the orthopaedic surgeons in Melbourne. I've born and bred here. My dad's Egyptian, my mum's Scottish. So I'm happy to say that I'm literally a mongrel, and it's an absolute honour to be able to speak to this community because it is really a part of me. So I just wanted to run through this quickly. I've been involved in viruses and vaccines since '91, back in the Ebola stage. But I just wanted to run through this slide for you. So this is the idea of the coronavirus here, and it's obviously 1,000 times smaller than the width of a hair, and obviously it comes through the air. But I wanted to just, as Afif was saying, just run through and just have a look at it. And the idea is this is the corona, these spikes, and it has a big fat layer, but it has a double-stranded RNA, and this is the idea of what we were talking about. Now, the idea is that it's, the most important idea of wearing a mask and everything is that it's traveling in the air. And when you look at the studies, we don't exactly know how and where they come from in terms of how far, so if you cover your mouth, but we know that just simply by them coming through the air, you then have to breathe it in. Now, it goes in through the nasal passages and goes down into the breathing tube. And one of the interesting factors here is that there is a specific immune response on the lining of your breathing tubes as opposed to the lining of around your body. And it's really important. And why is this so important is because the Monsignor was talking about a person that had to be put on a breathing or ECMO at the Alfred. And I just wanted to explain why. So what happens, these are your lungs. And if we look at the little air pockets where we actually breathe and we magnify them up, you'll see that the actual virus, and we know this, actually goes and attacks the cells in those little air pockets. That's in here. And if we magnify this up, you'll see that there's a specific receptor. We know this and the way it interacts. So this is the coronavirus. It has a specific receptor in the lungs. This is why it makes it so devious. And this is why it's called corona. This is the spike, because it's literally like a lock and key. And then it's really smart and it goes into, and so it's passed into and absorbed into your lung. Once it goes and passes outside your lung, your immune system, which is a remarkably sensitive machine, picks it up. So your body's incorporated the virus. Now, as it goes into the lung, this is where all of a sudden the inside of this virus, this RNA of the virus, goes into your own cell. This is your own cell. So that RNA from the virus goes into your own cell And that's where the virus starts being alive and starts making copies. Now, why does this make a difference? Well, the reason why it makes a difference, because as it makes more and more of these viruses of it itself, it has a secondary effect. And this secondary effect is all of a sudden fluid. It makes the actual cells in your lungs, these air pockets, widen. Suddenly there's more and more fluid. Your capillaries, which take all the vessels, suddenly get wider, and fluid and everything starts increasing, including these things called macrophages, which is like the battle armor and the army, and the blood vessels start to dilate, and all of a sudden your white cells and all this sort of stuff goes into these air pockets, which usually only got air, are now all filled with white cells ready to attack, and that causes a lot of inflammation. Once that inflammation happens, the blood vessels start breaking down and they start swelling, and once that happens, you get this next set of effects, which is instead of it filled with air, you'll start filling with fluid. That's why it's not like an asthma attack or anything like that. Once the fluid starts filling up in your lungs, it's really, really difficult to get rid of. And that's why the problem of you dying from COVID is because you get exhausted. It's really tiring because you can't open your lungs here because you're so full of this fluid, there's not much air there. And so this is the idea. The problem and the reason why is it's not just affecting your lungs, it then unfortunately can affect your brain, your heart, your kidneys, and your liver. And there's this thing called long COVID, which we're only now understanding, where people get the respiratory problem like a pneumonia, and then they remain breathless. They remain affected. And this is where sometimes it can cause blood clots, clots into your lung, heart attacks, and all sorts of information. So I just want to stop there, but that's the concept really of what COVID really does. So I just wanted to make sure people are clear about this, where we are very acutely aware of the medicine and the way when you do breathe it in and its subsequent effects. So I hope if you've got any questions that we're able to answer it, and I'm more than happy to be involved.
Thank you, Dr. Ashraf. Ashraf, we now go to Dr. Amba.
Thank you very much, Vivienne. I'd like to start with an acknowledgement to country. So I'd like to acknowledge the traditional owners of the land on which I'm on. So I'm in Melbourne, the Wurundjeri people of the Kulin Nation, and I'd like to pay my respects to their elders past, present and emerging. And I'd also like to thank everyone. It's a real honour to be on such an amazing panel with such distinguished guests. So to give a quick background about myself, I'm a GP in Melbourne. I work in the northern suburbs, and my clinic where I work is in one of the hotspots areas in Camberfield. And we've been through lockdowns last year, multiple ones, and we didn't see a lot of coronavirus infection. It was still something you heard about that was happening elsewhere, and we weren't seeing it with our patients. They were just stories. And what's happened, of course, as you know, it's in the media now, almost, I think 74% of cases are now in the north. It's become very real. So I've had many conversations with patients over telehealth who have coronavirus, who are very unwell. We know of multiple families now who are very, very sick with the virus, struggling at home. We have families who have family members in intensive care and ICU. And it's definitely hitting home to everyone where we are now, and it's becoming much more real. And I can tell you, when we started, so we offered vaccines at the clinic. We had AstraZeneca, and we're still waiting for Pfizer. We noticed that we didn't really have, and I have a majority Muslim clientele, you can imagine, at my clinic. We noticed that the lists were not full of people from our community. It was either people coming from other suburbs because they couldn't get appointments in their suburbs. And we'd be lucky if you saw 1 or 2 patients from our clinic that were getting the vaccine. What I've seen since this outbreak has happened, which I wanted to share as a positive note, is that people who I saw and had many conversations, because I'm always trying to sneak in the vaccine conversations with everyone because I wanted everybody to be protected. I've noticed there's more people in our community that are getting vaccinated, which is amazing. They're on the waiting list for the Pfizer as soon as we get it. So it's definitely, I'm noticing a change of heart, but I'm very saddened, of course, that it's happened so late in the piece. We had time up our sleeves to get vaccinated, and unfortunately, like Professor Dr. Afif was saying, that we had people that were just led down the wrong path with all this misinformation. And there's so many of us that have been really, really trying hard to challenge that. And as futile as it seemed a few months ago, I think it's definitely having an impact, and we're getting messages. I'm getting personal messages on my social media that people are getting vaccinated. So yeah, it's definitely real from where I am and where I'm working from my point of view.
Thank you very much, Dr. Ramba. Okay, so we are now over to all of us. If we have any questions on our behalf or on other people's behalf who've sent through questions, given that they couldn't join us for a variety of reasons today, that would be really good. I have a few left over from last Wednesday, so perhaps I could start with that, if that's okay. So one of the questions that was asked was, why do the workers have to be forced to get vaccinated?
Did you want me? I can.
Yes, over to the panel. Dr. Afif, you are on mute again.
Pardon. Can I please start by answering this question? I retired from active surgery about 7-8 years ago, but I went into aged care, and I now run 3 aged care facilities. In these facilities, the median age or average age is about 82. And every single one of my residents has got medical problems. We saw what happened last year when the hotel quarantine fiasco and the virus got into aged care. One of the nursing homes in Glenroy, St. Basil's, they had 45 deaths. It was brought in by workers. People did not get an understanding and appreciation of the devastation that happened at that place, plus others. The place went into lockdown. The workers did not come to work because they were frightened of catching the virus. So the government sent in workers who were dressed in full PPE. They looked like space people. They started looking after residents who were mainly ethnic in origin, mainly Greek, who did not know them, did not speak the language. Many of those residents were sent to hospital without their families knowing where they were. The families couldn't get in because it was a lockdown. And there was a case where a fellow kept ringing the nursing home, no one answering. When they answered, they had no idea who was who. He found out 5 days after his father died at the Royal Melbourne that his father died. Now, that's the human factor. Now, the viruses last year came into the aged care facilities by workers who were working there. They were working at multiple sites, and even though they were sick, they still went to work, because if they did not work, they did not earn a wage and they did not put food on the table. I was one of the very, very first people to come out publicly and say it. And I did say it to my workforce: no jab, no job. They bring the virus in to the most vulnerable in our community, and the results were devastating, 700, 800 deaths. So if people are going to say, why are you going to force workers to be vaccinated? Well, let me tell you this. We have road rules. You can't do more than 100 kilometers on the highway. You can't do more than 60 kilometers. And these rules are there to protect people. I want to protect the most vulnerable. And as we have just been told that with the Delta variant, we have got now younger people who are being infected. And let me say this. A lot of them would say, yes, but young people can get infected. It's mild. Yes, it is. But we have people, young folk, who have medical problems that make them as vulnerable as the elderly. And these are the people we have to protect. So I can understand employers. I have a friend of mine who's got a couple of restaurants. And when he is going to be able to open up, he's already said to his workforce, no jab, no job. And he's going to say to his clients, if you're not vaccinated and you can prove to me that you're vaccinated, you're not coming into my restaurant. Qantas have already said to their workforce, no jab, no job. And Qantas have already said, if you're going to fly with us, you're going to have to prove that you're vaccinated. And in fact, I'm a frequent flyer, so I have just uploaded my vaccine certificate onto Qantas, so that when I now go to book to fly, when we're able to fly, Qantas will know that I have been vaccinated. Now, we are going to get to the point, we will get to 70% full vaccination and 80% full vaccination. The people I'm going to be feeling sorry for are those who have got comorbidities, who are on immunosuppression, even children who have got Down syndrome or various other medical conditions. We've got to protect those people.
Thank you. The questions are coming through thick and fast. Dr. Ashraf or Dr. Amber, anything you'd like to comment?
No, I think Dr. Afif or Professor Afif has answered it quite well, but I actually agree with what he said, and it's crucial, especially if you're in healthcare. You need to be vaccinated. We have vulnerable, unwell people coming in all the time. So, and if, for example, in a general practice clinic, there are people in the waiting room, there are pregnant women, there are small children, there are newborns that we don't have the vaccine available for yet. So we need to protect those that are most vulnerable. So I actually am in agreement with mandatory vaccination, as I know as harsh as that sounds, but it's to protect the vulnerable. But can I say in fairness too, it's also to protect health workers. So it's to protect staff at a clinic, reception staff, their immediate families, us as doctors, nurses, anyone who's in that kind of environment. And at the moment, COVID can be anywhere. I think we also deserve to be protected from illness as well. Even though we are vaccinated, we do know that you still can get the infection, and nobody wants to suffer and be unwell unnecessarily. And the other issue is there is a smaller chance of us spreading it to vulnerable people in our own households. For example, some of us have young children at home. So it's making sure we protect the most vulnerable.
Dr. Ashraf?
Look, I'm as unfortunately I'm just as on board with Afif as anything. I'm as blunt as they come. Unfortunately, I'm not here to be a diplomat. I'm pro-mandatory vaccination. I'm anti-lockdown. I think everyone needs to be vaccinated. It's the only thing that we have to prevent this disease. One of the questions was that what are the alternatives? We don't have anything that prevents it. That's the problem. When you do get it and you get really sick, we have heaps of things that we can give. They're now anti-monoclonal antibodies, also, there's steroids, but nothing, as you can imagine, is like preventing the disease. And with the vaccines, we know one thing: it stops you from going into hospital, going into intensive care. So I think all of us really, it reminds me of this is a multicultural, multi-faith presentation. And, if I look at all the, Jesus and I look at Muhammad, and all of them are trying to protect the weak and the poor and the elderly and the sick. They would be standing up. This is what they're all about. And I hope that that's what we would be doing for our own community, regardless of the backlash. So I have no, I don't make any qualms about it. I want everyone as much as they can to be vaccinated. It's definitely safe. 5 billion doses and more, and the side effects, and I can go through all of those things if you would like.
Thank you. We'll go to Bernadette and then back to the questions in the chat function. Bernadette.
Thank you, Vivienne. One of the questions is almost up there for what I'm questioning. I've got two questions, if I'm allowed to be cheeky. The first one is, and on one of these, I've had my first shot. So how serious if we're to get the virus after having the first shot while we're waiting for the second vaccine, number one? And number two, I'm the chair of the business women's group from the Australian New Zealand Lebanon Chamber of Commerce and Industry. And we're having a lot of women question about having the vaccine, predominantly for their children, both male and female, in relation to infertility. So I've got those two questions, if I can, please, doctors.
We'll go to the professor, Dr. Afif, again first.
Oh, thank you very much. And Bernadette, my love, you're allowed to ask 10 questions, not just 2. If you do have, let me answer the second question first. It has absolutely no effect on fertility.
Can we just get Dr. Amber to confirm that too, given that Dr. Amber is a female? Dr. Amber.
Yes, yes, that it doesn't. That was a rumor that was spread via Twitter by, I think it was a German or research scientist, because of a link between some protein that's similar to in the virus, but that's all been now debunked. So that's where the rumor started. So, but there is definitely no impact on fertility, because women who were in the trials who had Pfizer vaccine, some of them inadvertently did become pregnant after receiving the vaccine, and they've been fine and since have gone on to have babies and have been unaffected.
And this is the problem with people who call themselves scientists or profess to be professionals. They come out and say something, and they do not appreciate. They're such morons. They do not appreciate the effect that it's going to have on people. So it has nothing to do with fertility. It has no effects at all on pregnancy. And if you've had the first shot, Bernadette, you are covered somewhere around, and I stand corrected on this, somewhere between 40 to 60%, whereas when you get the double shot, you're about 95% protected. So even with the first shot, there is protection.
Well, one of the parts, just to add that idea of just to give it, to see the wood from the trees, the vaccine is the active ingredient is incredibly small. And most of the actual vaccine that you get, the actual constituents are trying to keep the active ingredient around long enough to get to you. It only stays in your body 2 to 3 days at the most. So once you get the vaccine, your body breaks down the vaccine within 2 to 3 days. After 3 days, the vaccine's gone. The rest of the effect is your own natural immune system responding to the challenge of the vaccine, that usually is around 6 to 8 weeks. We know this because for the last 200 years, looking at the side effects of vaccines, all of the vaccines, if you're going to see a problem or a side effect, it will happen in the first few days to the first 6 weeks. So that's the basis, let alone we also have seen pregnancies and other things. So I hope that helps.
Thank you. I'll go to the chat function for two similar questions. If I'm vaccinated, does that mean the vulnerable that may catch it from me won't be as severe? And then the next question is, can fully vaccinated people still catch the virus and spread to others? We'll go to Dr. Amba and give Professor Dr. Afif a bit of a break.
So as far as I understand, and please feel free to correct me, if I'm vaccinated, does that mean the vulnerable may catch it from me? You can still spread coronavirus even if you've been vaccinated, but the transmission is much reduced. And from what I was reading, it's 40 to 60% less likely, I think, for you to spread it. And it makes sense that if you've got the infection and your body's already fighting it, if you did spread it, the viral load should be a lot lower when you sneeze or cough on someone else. So that means they should have a much milder illness.
And
I might hand over to Dr. Ashraf.
Yeah, but it's also very short. It's a lot shorter. So because you've been vaccinated, you even if you get infected, even if you do get the COVID-19, it doesn't last as long because your antibodies and everything are working against it. So instead of, say, shedding and giving off the virus for 14 days or 3 weeks or 4 weeks in someone that has not been vaccinated, in fact, you may only shed and you may only show the virus for a couple of days. So it's a very, very powerful mechanism to stop the spread. It's so effective. And that's one of the ideas of being vaccinated versus, by the way, the vaccines, it's not like armor. It's not like we're asking you to be vaccinated and you're wearing armor against COVID-19. What we're trying to do is prevent the symptoms from being so severe that you have to go to hospital or you have to be put on a breathing machine. Because if what the idea is, I know it's a bit funny, but we want to change this pandemic to the virus becoming endemic, just like a cold. So we want to transition this phase. So we want to get everyone vaccinated so it doesn't become as serious. So we actually get it. Everyone that gets it doesn't become so severely affected. That's the whole purpose of what we're trying to do.
The question here is, if I am vaccinated, will I still catch the virus, but that those who catch the virus from me, the impact on them will not be as severe?
It's not necessarily the case.
Right. So if I'm vaccinated, I can still catch the virus and I can still spread it to others, and the impact to others who are vaccinated or not vaccinated. So just because I'm vaccinated doesn't mean that the virus that comes from me isn't
correct.
Okay, right.
We do know that the virus is a lot sicker. We do know because when they try to grow the virus of people that are vaccinated, they would classify it as sicker. So it's not as strong. We do know that. But here's the kicker, and here's the problem, which would hark back to what Professor Afif is saying, is that even if you give a sick virus to someone that is, say, 95 years old, or someone that is on cancer therapy, or a 5-year-old who's got cancer and getting chemotherapy, they will still get very sick. They don't need a strong virus. That's who we're trying to protect.
Right, thank you. Thank you.
Viv, may I ask a question on behalf of someone? Is that okay?
You can, but if I may, Faddy, we need to follow orders here. So we've got 2 hands up. So we'll go to Abby and then Bernadette, and then back to you, Faddy.
Thanks, Vivienne. Thanks, everyone. It's been a very informative night. I just want to say, in terms of fertility, I do have 2 teenage daughters. I was a bit worried about it as well, because I've got people from different faiths calling me, telling me, oh, don't give it to your kids. And And I know one of them is in year 12, but I got the best advice from my mom. And even though I was thinking she would be a bit hesitant, she said to me, you have to be alive to have babies. If they're dead, they can't have, you can't talk about fertility. And that was why I just, rest the case and go give it to them.
Thank you, Abby. All right, we'll go now to you, Faddy, and then back to Bernadette for your second question.
First, I'd like to acknowledge again Monsignor Joe and Sheikh Tariq for being with us, and also the panel who are led by Professor Afif. I want to thank you all very, very much. Look, the question I have is someone who is, his name is Mr. Antonio Zoureibi. He's a former honorary Syrian consul to Victoria, Tasmania, and South Australia. He asked a question about why aren't we also promoting healthy life and healthy lifestyle to actually combat the virus? That's a question or a comment and a question he raised with me. So I thought I'll see what the panel's opinion about that is.
Viv, can I answer that, please?
I'm very sorry, Professor Dr. Afif. No, you go ahead, please. You're in charge.
I'll tell you why. I'll tell you why. Because this Rabi is a very, very close friend of mine. And he actually sent that question to me about 15 minutes ago. Mr. Zoureibi is one of the fittest people you can come across. He's incredibly fit. He leads an incredibly fantastic lifestyle where he watches what he eats, he exercises regularly. And the only sad thing about the lockdown is that I have not been able to sit down and have a beer with him every so often. It's a superb question, but the answer to that is we do encourage lifestyle. We do encourage eating Lebanese food because that is the healthiest food you can have. Except we eat too much of it. But despite that, the fact that you can be incredibly healthy as Mr. Zoureibi is, the virus will still get you. And that's why we want you to lead a healthy lifestyle by eating good Lebanese food, not as much meat as we should, not as much kibbe, lots and lots of tabbouleh and beans and all that sort of thing. But you still need to be vaccinated, Tony. And if you're not vaccinated, I'll come and jab you myself.
What about Dr. Ashraf and Dr. Amba? Are you going to accompany Professor Dr. Afif to come and give Tony a jab?
Yes, I'm happy to help. We've got Pfizer coming and AstraZeneca. So.
Yeah, and there's Moderna as well. So there's so many options. We're just going to give you, it's like a menu, and you can just choose whichever, and you can have the tabbouleh on top of that, no problem.
None of the AstraZeneca, I'll make sure he has that.
That's
he
really great.
Qualifies for the AstraZeneca.
I know, he does this.
Yeah.
Thank you. There are also a number of other questions in the chat function, but we'll go to you, Bernadette, for your next question.
Thank you, Vivienne. It's actually a question I've received, and the delegate is with us. It's from Antoine Manassa. Antoine, I'm not sure if you're in France or if you're in Lebanon. And I'm going to actually ask you to unmute yourself, Antoine, and maybe you, because you speak English. So if you don't mind, perhaps you could ask the question, Antoine, if that's okay.
Merci, Bernadette. Hi, everybody. I'm actually in Lebanon. But my question was that on the 20th of March, last March, I wanted to get back to France, so I was positive during the test. So I was hospitalized for around 15 days in the hospital in Lebanon. So I got the COVID-19 at that time. When I came back to France, immediately I make some exam, and the doctors told me you need only one vaccine, not more, because you got the COVID. So when I came back to Lebanon I got the first vaccine. They didn't provide me the certificates because the Ministry of Health in Lebanon imposed the second vaccine. So I got the second vaccine. So I don't know if it's dangerous or not, or I want to know something about it. I'm still in Lebanon, leaving for France next week. This is my question.
Yeah, go ahead, Dr. Ashraf.
Yeah, so this is more to do with policy and to do with immunology. So if you consider, and this is the idea of, I suppose, vaccines in creating immunity and getting infections and creating immunity. If you've had COVID-19, effectively you have developed and you've survived, you've got an element of a natural immunity. And so some places classify that as having had one vaccine. To me, that makes sense, right? The only thing is when you get natural immunity or one vaccine, or effectively it's like you've been vaccinated once, it probably makes sense to get a second top up, as it were, a second vaccine to raise your antibodies. You know, so that would be the idea. Really, the bottom line in terms of immunology is you're trying to expose your body more or less twice to get your antibodies high enough. So if you keep on getting exposed to COVID-19, your body is ready for it. That's the basic idea. But the problem is each country sometimes is very rigid. You can't come in without two vaccines, or, you know, they don't incorporate well the idea of you being COVID positive, because if you're COVID positive, we don't know how to track your immune response. So if you have a mild COVID-19 exposure, it's not like your antibodies are really high or really low. We don't know. That's the idea. That's why they can't make a decision. It's not, and it's not, there's no fear. It's not like if you get a second vaccine or you get a third vaccine, that's not going to cause any problem.
I got fever the first time and the second time, 38, 39. Is it normal for 2 days?
Yes,
each
absolutely.
time?
Yes, that's the normal. That's your normal immune response. Some people overseas would argue that if you don't have an immune response at all, you may not be seroconverting. You may not be producing enough antibodies. So it's in from the immunological perspective, it's a good thing to see, and it's reassuring to have your immune respond. You're challenging your immune system. You want to see something. You don't want to get the jab and feel nothing.
Merci beaucoup, Dr. Ashraf.
Merci. Bon appétit.
Merci.
Thank you. There are some more questions in the chat function. Robert, would you like to ask your question?
I've got little children. How are you, everybody? First, I've got little children, and you know, they are under 14, and I needed, you know, like to give them the jab, but I'm worried their bodies are growing, and this is a question many people are asking. You know, would it affect you know, anything in their growth? Is there any studies at the moment, you know, that's being concluded about the children? Maybe, you know, it's better, you know, to delay it a little bit, you know, to see maybe there is something much better, much safer, because, you know, everything happened so quick. And, you know, for us, like an adult, we can take, you know, the risk, but for our children, you know, we need to protect them, but not, you know, to do like a herd, you know, some bad, you know, like results later on. So it would be good, you know, to, you know, let me know and everybody, you know, what are the studies happening at the moment and how safe it is.
We'll go to Professor Dr. Afif.
Thank you, Viv. Good to see you, Rob. I'm glad to see members of the Australian, New Zealand, Lebanese Chamber of Commerce and Industry listening to this. Your children have already been vaccinated against the measles, mumps, and so on. Vaccination in 14-year-olds, in fact, we're now saying that children 12 years and over can be vaccinated is very, very, very safe. Even though their bodies are growing, that's fine. All that we're doing, remember what Dr. Ashraf has said, all we are doing is that we are introducing a very small part of this coronavirus, the mRNA, and all that doing is stimulating a response to the virus. So they're protected. And as you heard from the figures that were presented earlier, the young children are getting the disease. So what better way to protect them than to vaccinate them? It's not going to affect their growth. It's not going to affect anything. All it is, it's going to give them an immune response. Sorry, Ashraf, go ahead.
I just think, I'll let Umber think, but the immune response from children, they've already basically got a full coverage of immune system mechanics in their body at 12 and 14. So there's no difference. That's the idea of why we often give vaccinations. In fact, you'll probably see that the vaccinations will drop. It won't be 12, now it's 12 years old and up. It'll drop. And they've been doing studies in Colombia and all these other places where they've been giving the vaccination to 5-year-olds. It's often in the past history, in the 1940s and the 1950s, everyone that's attending clearly is very young, like me. They're obviously, 20, 21 years old. We can't remember 1940s and 90s, but we've studied it. And in fact, the times when we were giving vaccines were the very, very young, because they were the ones getting affected by polio. They were the ones getting affected by diphtheria. They were the ones getting affected by measles. If you've never heard of these diseases, that's only because the vaccinations that were given as young children, 4 and 5 years old, have been so successful. At 12 to 14, you have an adult immune system. Your response is like an adult, and it's only there for a few days, and the vaccine's broken down.
Doctors, are there at the moment, I read in the newspaper, that there is, in Western Australia, there is a vaccination getting developed, and it is unique. This vaccination, it stops the spread. It's not like the other vaccines where if you get infected, you pass it on. This immunization jab, it just stops, the spread. Is that correct?
I might just jump in. I haven't heard of that, so I might let the other panelists talk about it, Robert, but I did want to mention that I understand you said you want to protect your children from any harm, and I had the similar choice as well, because I have a 12-year-old and a 6-year-old, and it's the same thing. If you look at other viruses in the past that have impacted children, for example, mumps can cause infertility in boys and men, meaning they may not be able to have children when they're older. If you look at the history of chickenpox, I don't know if anyone can remember the last time they saw a child with chickenpox, and I'm of a generation, I did have chickenpox growing up, but I have not seen it again, and that's because of the vaccines. And my worry basically is we're here to protect our kids from coronavirus, and we don't know the long-term impacts of the virus. And we are seeing, and if you look, there are studies now and centers that long COVID is affecting children. It's not as severe, I've heard. I'm happy for anyone else to jump in on that, but it does impact children long-term, and that's my worry. So I'm definitely, I've got my child vaccinated, so he's vaccinated double dose with Pfizer, and I'm actually looking forward to the next, when we can vaccinate the younger ones.
Okay.
One thing to be aware of, I suppose, just to be aware of the boys, we know that the Pfizer vaccine is, it's usually 12 and above. It's the boys and it's the second dose of Pfizer or Moderna that gives this inflammation of the heart. Very, very rare, but that's the group. Again, there's a nuance to it all. Like I could spend an hour explaining it to you, but the doses, it may be dose dependent. There's a lot of nuance to this conversation. Not that I need to go into it now, but obviously Pfizer's 100 micrograms, Moderna's 400. So it's a lot. It's a bigger dose, and so we're not sure whether or not the kids will be getting a different dose. You know, for example, we might be giving kids later on a smaller dose, but regardless, the dose that we give to adults are having no side effects.
It's good you brought up, you know, the inflammation of the heart, because I've got that condition myself.
Yeah.
And it is important, you know, for whoever is listening to check with your cardiologist or your doctor to see which jab is best suited, you know, for themselves. I was given, you know, AstraZeneca because of my condition. And I took the first jab, you know, today, which is so far so good.
Yep. I had AstraZeneca too.
Yeah.
Robert, I think
Excellent.
you said that you read in the paper that they are developing a vaccine in Western Australia which will stop the transmission.
Correct.
I don't know where you got this from. That to me sounds like a lot of garbage. Western Australia at the moment want to secede from Australia, so they're probably working on something weird and wonderful there. Don't let anyone tell you that there is a vaccine they're developing that will stop the transmission. All that the vaccine does, as Dr. Ashraf has explained to you, all that the vaccine does is causes you to produce antibodies and these killer cells called T cells, so that when you come into contact with that virus, you've got an army which is already there, and it'll fight it. But don't think that they're going to get a vaccine that will stop you from transmitting it. I have no idea which newspaper you read it in, and that sadly is where a lot of stuff comes out.
Yeah, if I find it, I'll send it across to you, Professor Afif.
Yeah, I would love to see it.
Yeah, good.
Thank you very much for that exchange. It's great to also listen and learn as well. And I didn't realize that either, Professor Afif. I didn't know that there is something happening in WA that we weren't made aware. That's really good.
Indeed.
We'll go to Glenn for your hand and also for your question in the chat function as well, Glenn. Thank you.
Good evening, everybody. I've just got a question which sort of relates to myself having low platelets genetically, and whether or not the blood clotting that we have seen in certain vaccines. And secondly, me and my family work very hard at building a strong immune system through what we eat. I mean, we probably overdo it, to be exact. So does that not play a role in building a healthy immune system, and why doesn't that count as a defense, a preventative defense towards not just, I suppose, corona, but anything? But I can't remember the last time I had a flu, all these sorts of things. So for me, there's not a healthier debate about, you know, what alternatives there could be, preventative or after you get it. And maybe to address another elephant in the room, which I've read a little bit about, the what's it called, ivermectin, something or other, which is getting some a lot of ivermectin, which is getting a lot of talk in certain circles, and you know, some of the literature out there, which is scientific and medical, you know, they're very hard to disprove in a lot of ways from a novice like myself. So I suppose that's three questions in one. I apologise, but
can I just say I'll take the easy question, or I can address the one. Ivermectin is an anti-parasite, so it's worms. So the idea of treating a virus, it's like, for example, if you've got a bacteria and you treat it with antibiotics, obviously the antibiotics are going to kill the bacteria. It's not really going to do anything to worms, right? So that there's an idea of the basic science, and ivermectin is just a worm. Usually you take 7 tablets, it's 3 milligrams a tablet, you take 7 of them and you have it once every 6 months. It's only to treat worms. One of the ideas and one of the things that the people have taken, I suppose, is that ivermectin in the studies in a test tube had some antiviral response. That's it. It's like telling someone that has worms, take some antibiotics like penicillin and it'll do something. It won't do anything. We know the studies, and there are huge numbers of meta-analysis in the Cochrane where they've looked at ivermectin and it doesn't help. It doesn't make any difference. So that's the easy one that I would say. It's not that it's a drug, has all the side effects of a normal drug. And by the way, as a doctor, if someone asked me and there was a drug that I would prescribe to help someone and save you, I wouldn't care what it's called or why or how, or whether it's an anti-helmet, but it doesn't even make the basic science sense.
Yeah, and can I jump in there with the answer regarding the immune system? So we hear that a lot. People will come in and say, what can I do to boost my immune system? What foods can I eat? What vitamins can I take? And the thing is, it comes down to an understanding of how the immune system works. So foods in itself, of course, being healthy, having exercising, having a healthy lifestyle is extremely important, but that in itself does not do much for your immune system. So you can't boost your immune system just from foods, because if, for example, when we are exposed to a substance like a virus, our body then starts making antibodies to them. And that's how then we are protected. So that's how your immune system works. So food in itself is not going to somehow boost it. And when I hear boost the immune system, I think of conditions when your immune system is really boosted and overdrive. You have conditions like leukemia and blood disorders. And when your immune system is not working properly and is being attacked, these disorders like HIV impact on your immune system. So when a doctor hears that, it's very hard for us to understand from a scientific point of view how food in itself can actually do anything for the immune system, other than, of course, making sure you're healthy, you're the best in terms of your health.
Okay, so you're saying that certain foods won't give you a boost in your immunity. So, I mean, I'm a little bit conflicted about that. So I thought...
So it's exactly the same. For example, in a lot of the people are moving towards, organic food and food that is healthier and non-processed. In the 1940s and the 1950s, people were eating the healthiest produce. They were all purely organic. They're eating from the land. There was no pollution, or at least a lot less pollution. People were there was no problems with their immune system, and yet they were struck down by polio and the viruses that we have. The idea that you can, and this is the fallacy, the idea that you can somehow manipulate your immune system. Your immune system is what you're born with. If all of a sudden there was a way or a mechanism for us to boost your immune system, we would be telling you to do it. We have no hidden agendas. I'm a surgeon, I'm an orthopedic surgeon, I'm also a doctor, I've been studying immunology. The idea, and we're not trying to hide anything from you, because in fact, if I wanted to make more money, I would be encouraging you to do all of those sort of things, because you'd come to see me and I'd write you a prescription of more tomatoes and garlic and olives. And, I've heard it all over the years, but sadly, it doesn't change anything in terms of when you're attacked by the virus and the bacteria. That's all. There's a difference between disease and the idea of you being healthy.
Yeah. It's the same with foods and toxins, and people will say, I need to detox, or I need to drink a juice to cleanse. That doesn't work. If you have a healthy liver and kidneys, your body is detoxing for you. Drinks and things and vitamins and things can't really detox. I think the only thing that if you have ingested a toxin, something like charcoal will be able to absorb it, but foods in itself or drinks can't actually clear up toxins at all. So that's another misunderstanding that people have about health.
Sorry, there's just that one. So I've got a low platelet.
You shouldn't get AstraZeneca. There's no doubt about it, because the thrombocytopenia, the clots, which is the opposite, you've got low platelets. you're probably, theoretically, you're at a higher than normal risk of getting that immune response clot. And so therefore Pfizer or Moderna is probably the way to go.
Wonderful. Thank you. Thank you so much.
Pleasure.
Okay, Doc, let's go to the questions in the chat function. After we've taken the vaccine, do we have to take it again? It's a question from Ahmed. Could we go to Dr. Ashraf for your first response, followed by Dr. Amber and Dr. Afif?
So do you need to take 2 doses? I think if that's the question, is that the question?
No, I think they're talking about a booster, Ashraf.
Yeah, so at the moment, we know that the idea of giving, and basically all you're doing is you're showing your body twice the actual portion, the spike protein of the virus. I explain it to you like you're going to have a really, really hot meal, and it's like a super, super hot chili. The first thing you do if you're going to give your kids an introduced hot meal, give them a little bite. That's the first vaccine. It burns your mouth a bit, no problems. You wait 6 weeks till you get it out of your system in a way. You take that second bite, and then you're ready to go a hot meal. The idea of a booster is still not, there's no literature to support a booster. All the boosters, or the idea is to just show your body, to again, show your body so it's prepared for the virus. Usually the boosters are going to be in people that are 90 plus or immunosuppressed or have got chemo where their immune system is low. But at the moment, there's no suggestion that there is any booster.
Hang on.
Yeah.
Oops, sorry.
I will, sorry. No, I'm joking.
With boosters, exactly what you've said, Dr. Ashraf, we don't know much about it, but I think it may be in healthcare workers and things, that's something that they'll be looking at in the future. But to understand why we have to have boosters, and if you look at other vaccines, your immune system sometimes can forget, so your antibody levels can fall. And for example, when I look after a lot of pregnant women, so I do a lot of antenatal care and shared care. We would do blood tests at the beginning of pregnancy, and we'll find in some women the hepatitis B surface antibodies are a little bit low. And then what we do, we note that, and we'll say, okay, once you've had the baby, it's probably a good idea to have a booster shot to bring your antibodies up. So that's the idea behind having boosters. There's no, I don't think, if people are worried about it's trying to control us, or we're trying to, they're trying to keep injecting us with things. It's nothing like that. It's just making your body remember to make the antibodies, so it's got that power and that army ready when the virus does attack, that your body will be able to defend itself.
They recently, I think over the last I think the last couple of weeks, there's been a study that's been published, I think in the Lancet, where it showed that a booster is not necessary. However, in Israel, which was a country that was the vaccine was rolled out very, very quickly, they're beginning to see the variant come up, and they are starting to think about a booster. But thus far, as Dr. Amber has said, there is no consensus as to whether a booster is going to be needed in 6 months or 9 months. My feeling is that we're going to get a mutant, just like we have the Delta. We will have some mutation, and we may well then need a booster, if I can call that, for that variant. But at the moment, there's no recommendation. Once you've had the 2 doses, that's all that is required. But things may change.
We get tetanus, we get boosters all the time for various diseases. There's boosters for tetanus, there's boosters, and the idea of a booster really is just from an immune response. The idea really is to just expose your body again because your antibody levels drop. In fact, the antibodies is not the whole picture. Can I just say the antibody levels, when they test it, is not even a reflection of your whole immune system. It's a bigger mechanism than even that. And you have memory T cells and memory B cells that actually produce more antibodies when you're exposed, when you need them. So we don't run around in your body carrying all these antibodies all the time. It become too heavy. You break them down. And that's the fascinating miracle of our body. When you're exposed, that's when you actually need those antibodies and you'll get a response.
And I second that. We do have these memory cells. So even though the antibodies have disappeared, if that antigen appears in the body, the memory cells already know about it and they go into action. That's been well known for, gosh, I learned that 50 years ago at med school.
Absolutely, absolutely.
Thank you. There is a question in the chat function from, is that Nazar? Nazar, would you like to ask your question? Okay, if not, the question is, the mRNA is a new technology being trialed in humans and cannot be compared to other vaccines made in traditional ways. Keeping in mind a children's vaccine.
Nizar is on.
Oh.
It's okay. Thanks, Vivienne. If you can just continue reading the question, probably we'll do the same thing.
Well, it's your question.
Oh, thank you. Yeah, just wanted to clarify. I'm not sure if this was discussed before because I joined a bit late, so I apologize for that. But yeah, just about the. I'm not sure if this was discussed before. So the first part of the question is about the mRNA vaccine. It's totally different from the traditional vaccines that we all know. And we're not very confident that it's actually the long-term effects. So with all what's happening in the media and everything, and in saying that, I'm with vaccines and myself, I'm booked to do it, but I try by myself with my network and our communities to try to encourage it. But we face this question a lot, and I'm not a medical expert myself, so it's a bit hard to convince people. Yeah. Well, first there should be a part of trust in the medical system, and always to listen to professionals in the right field rather than just listening to Facebook and all this media and that like we see on social media. So if anyone can help with this briefly, thank you.
Yeah, I mean, so mRNA vaccines, although you've just heard about it, obviously this year and last year, mRNA vaccines have been in the pipeline. I've been reading about them well past from 2013. They've been in the pipeline even before that. It's not necessarily that new. All it is refining the technique. So can I just run you through? Old school method, complete old school, I'd have COVID, I'd cough into a cup, get some boiling water, put the COVID into the boiling water and give it to the 5 panelists. One of us would get COVID and die, and the other 3 or 4 would get a bit of a symptom and it'd be okay. That's the old school vaccine. Then we got more smart, and instead of actually when they did cough into the virus, we actually looked at the virus under a microscope and we realized that it's made up of parts. Instead of giving you all of the actual virus, we took one bit of it. So you will never get the actual virus itself, but your immune system is so smart that if I show you only one portion, the most important portion, your immune system will be able to fight anything that looks like it. Then we refine it even more. So it's not just that I take a portion of the virus, the spike protein, I now know the gene that makes the spike protein. So instead of even giving you a piece of it, I actually give you the gene that makes that spike That's the mRNA technology. All it is, and I know I got lambasted last time, but it's like looking at the brick phone and now the 12S or the 13S, it's just a progression in technology, and we're getting better at it. That's all it is. It's not actually a new method. It's just a better evolution of the same thing. I hope that sort of gives you an idea.
Dr. Ashraf, can I just interject? That sounds very similar to homeopathy, which I've been, part of my holistic treatments, if you like. So homeopathy works in the same manner, doesn't it?
So I'm not.
Sorry,
so that explanation is that immunology. That's the actual physiological immunology of the actual progression of vaccines. I've just sort of explained it in a simple term. So that's the progression probably over the last, about 60 years. So that's the progression of vaccine technology. So that's the physiology.
Look, we are getting better and better at doing things. As Dr. explained, in the past, we used to get the whole virus, kill it, and then we inject it into your body, the whole virus, and you get the immune response. We've progressed beyond that. As Dr. Ashraf has explained, the reason why it's called the coronavirus, it looks like a crown, and it's got those spikes in it. So all we've done, what happened is that the AstraZeneca has taken the spike and injected it in, and you get the response. With the Pfizer and the Moderna, they've actually worked out what that spike is made up of. When we talk about the genome, it's a sequence of these things called amino acids. Code. So we know what the code is. So what we do, what the Pfizer and the Moderna does, is that they don't actually inject the virus, they just inject the code. That goes into the cell. The cell then makes that protein, the spike, which then stimulates the immunological response. Now, sadly, it's very difficult, and I mean that in the nicest way, it's very difficult for us to explain what happens at the cellular level to lay people, because you've got to know what a ribosome is, what mRNA is, and that sort of thing. Trust me. This technology wasn't born yesterday. It's been in the making for many years. It's just that now we are so good at reading the genome, we are so good at working out the molecular structure that we can use that technology. The Chinese, in developing their vaccine, are still using that old method of the attenuated virus, and they still haven't released all of their results, whereas Pfizer, Moderna, AstraZeneca, the results are in. It's very safe. And don't let people tell you because something is new, well, it's okay. We started with the phone, the brick 20 years ago, 30 years ago, and look how smart our phones are. It's a similar thing. Technology, we are progressing.
Can I just answer that homeopathy question? That it's actually nothing alike to homeopathy, because homeopathy is as I understand, is a dilutional. So you keep diluting water, and the water will remember whatever has been exposed to it. That's the complete opposite of how the immune system and all of that works. So I know what you mean from homeopathy. For example, if you're allergic to bees, the idea is you put a bee sting or something and you keep diluting the water, and then you drink that, and then you'll somehow get protection. That's not how the immune system works. They're just you're basically drinking water. It has no benefit.
Thank you, Doctor, for clarifying.
Could I just say one thing just about the mRNA to Nazar, just so you are aware? I know that we see COVID-19 and it's terrible and it's bad and it's a disease and it's a pandemic. Because of the mRNA technology, we now potentially are going to be able to be vaccinated against cancers. So the next step in cancers is using the mRNA, and we are in now the first steps of being able to be vaccinated against cancers. The other part is, I don't know whether you've ever heard of Ebola virus, which is what I was involved in 1990 and 91. And now with mRNA, if anyone or any of you are affected in Africa or whatever with Ebola virus, there is now a successful mRNA vaccine. So again, it's not, I know everyone's talking about COVID, but sometimes you need to see the forest from the trees, where this technology actually, your kids are probably going to benefit from this technology. They're probably not going to remember the pandemic, but they're just going to be take it in their stride.
Thank you. Professor Afif, did you want to make some more?
No, just ditto.
Nazar, do you still have more to ask?
Yeah, I'd like to thank Dr. Afif for the real good explanation, and it's actually that what we understood before from what we read on social media, that being a vaccine that deals with the DNA, and it's like they made it look like that they're modifying the DNA, and that will be a huge thing. And it's actually like the genes, and it's really, we all understand, but it's the way the doctor explained it was great. Now I have another question. It's probably a little bit more political. Could be why there's no other, like the Sputnik and the Chinese vaccine are not even considered in Australia?
Maybe we'll go to Dr. Afif.
Very simple. We've got CSL here in Melbourne, capable of producing millions and millions of doses, and we've got access to Pfizer and Moderna. Why would we want to go elsewhere?
Dr. Amba, is you hearing anything in with your patients or clients about alternatives to what?
There was talk about Novavax, I think, coming, but that hasn't come through. But I know Moderna should be with the pharmacies. As I understand, the pharmacists will be administering that. But I think we should use whatever we have. At the moment, we have this. I think, and we're in an outbreak, especially in northern suburbs. Just protect yourself. And use what you have.
Yeah, Sputnik. So if you're freaking out about AstraZeneca, you're going to double freak out about Sputnik. Sputnik works via two separate inactivated cold viruses. So what they've said is they put the code inside one cold virus that's been inactivated. They give it to you. You have your immune response to do everything. Then your second dose is not the same cold virus. It's a different cold virus, same code, and then they give it to you. It's so smart. It's so smart. Why? Because there is a potential for the body to have already seen the cold that we are giving the code in. Why does that make a difference? And I know I'm probably using up a lot of your brain cells here, but if you've put a code inside a cold that you have seen before, your immune system will destroy it, including the code. You won't get an immune response because it's already seen it. So you need to get the code into your body in something that your body has never seen. So they've chosen chimpanzee cold because it's assuming none of us got a chimpanzee cold. So it's the perfect vehicle to secretly get into your body. Your immune system hasn't seen it before. The code sneaks out in and your body reacts.
Oh.
So it's a really smart idea. We ain't going to see it.
Thank you very much, Dr. Ashraf. I really appreciate your explanation.
No, pleasure.
Thank you.
Thank you, everyone. Thank you for your questions. We're now at 8:38, and I think it's been a very mesmerizing conversation. I was told that I should stop smiling. Why am I smiling? And I said, well, I'm thoroughly enjoying the session, and I really am. It's been really great. Thank you. And I'm struggling with my son who's trying to change my background. Fraser, Mama's still working. Sorry. There you go. So thank you very much once again to our panelists, to Professor Dr. Afif, to Dr. Ashraf and Dr. Ramba for your fantastic, so insightful, so convincing, persuasive and mesmerizing explanations. I truly enjoyed and learned so much tonight. Thank you once again. Thank you, Ahmed and other members of the media for promoting and broadcasting tonight's conversation. Obviously, thank you to Faddy and Moustafa for being so wonderful co-organizers. And I thank the Lady of Lebanon, Monsignor Joe, as well as Tarek from the Preston Mosque for your tremendous support, and all of the community leaders and each and every one of you for doing such an amazing amount of work over the last few months to really bring the matter, not just to the Lebanese community, but to all other members of the broader multicultural community as well, in making sure that we try to debunk as many myths and anti-vax misinformation as we can, but also get vaccinated. Thank you very much once again, and thank you to Hugh for giving us the updates on the testing. And you've been let go free tonight. No questions on testing, everything on vaccine, and we've got 3 professional experts on the panel tonight. Thank you for joining us, Hugh. And on notice, I invite Monsignor Joe and Tarek to give us the concluding prayers. Father Joe.
We thank you, Lord God, for the blessings you have bestowed upon us. We thank you for all these wonderful people who've worked with us, who are informing us and teaching us. We ask you, Lord, to help us to have an open mind. We pray that everybody will be vaccinated. Let us share in working together, caring for one another. Our Pope said vaccination is a sign of love. Let us show this sign of love to one another. We make our prayer through Christ our Lord. Amen. Thank you.
And Tarek from the Preston Mosque. Thank you.
Thank you, guys. And it was a pleasant evening, a lot of knowledge. May Allah reward all the doctors involved and everyone that made their time tonight for us. To close it off, may Allah Azza wa Jal guide every single one of us and guide our community members, and make sure that we ask Allah Azza wa Jal to protect us all, to protect our families, to give us common sense, and to make everyone, take the jab and listen to the doctors, listen to the professionals. Like I said earlier on, our Quran says to us, speak to the people of knowledge. And at this present time, our imams can't help us. They can only help us in their prayers. But people of knowledge at the moment for us is our doctors. And they are the most essential workers for us. And they're the ones that are going to keep us safe and keep our families safe. So, Ya Allah, give them strength and keep them steadfast and on the right track. And may Allah reward you all. Jazakumullah.
Thank you, Tarek. And I'm wondering if Faddy and Moustafa, if you'd like to make some final comments. I'll go to Faddy and then to Moustafa.
Once again, I'd like to thank you, Viv, and the Multicultural Commission for conducting such an important forum. Again, this is about life in our community. It's not about anything else. I want to thank Moustafa, who also worked really hard with me to coordinate all this. I want to thank Monsignor Joe, Sheikh Tariq, Professor Afif, and Dr. Ashraf, and I forgot her name, Dr. Anyway, Rabab, thank you so much for your absolutely wonderful information session. And again, I encourage our community and the wider community to please get tested and get also vaccinated. The time is running out. We can't afford to take any more chances or risks.
Thanks, Faddy. I reiterate your comments, and thanks to everyone, Viv, the Victorian Multicultural Commission, but especially our guests tonight, the doctors, Monsignor Joe, Tarek, Dr. Umba, Professor Afif, Hadj, Dr. Ashraf. Tonight's forum is an example of leadership, communities getting together for a greater good. We only get out of pandemics when we're united. And I want to thank you as well from the Department of Health. The work the state government has done has been incredible behind the scenes with the community organisations. We heard over the last 24 hours or 48 hours, a significant boost and number of vaccines coming from the federal and state government to the north and west to protect our communities that have been hit hard, and we're seeing it firsthand. So please, while they've provided this, make the most of these opportunities to go to your local pharmacy or your community hubs. And I'm sure there'll be more announcements about vaccination hubs coming up. Protect yourself, protect your loved ones, and protect your families. Thank you, everyone, and really appreciate you tuning in.
Thank you very much, panelists, Dr. Afif, Dr. Ashraf, and Dr. Ramba, for your wonderful messages and explanations. Thank you to Father Monsignor Joe and Tarek and Moustafa and Faddy for your wonderful work and collaboration and prayers. And a special thank to the Victorian Multicultural Commission staff for joining us tonight, and all of you. Thank you very much and have a great evening. Good night.
Thank you.
Thank you very much.